We're diving into a topic that gets overshadowed a lot today. Mortality rates within the autistic community.
Yeah, it's true.
Heavy stuff.
Mm,
But I think understanding it can empower us to make a real difference.
you're right. Yeah, and it's important to note
Go.
that while autism itself isn't fatal,
Right.
statistically, individuals on the spectrum
Okay.
face a much higher risk of
Hmm.
premature death compared to the general population.
Oh, wow.
A study in 2017
Okay.
actually found they're 2.5 times more likely to die prematurely.
2.5 times. That's a huge difference.
Yeah.
It really highlights the urgency of addressing this issue.
It does. So let's get into the why.
Okay.
What are the main factors contributing to these higher mortality rates?
Accidental deaths are a major factor.
Okay.
And within that category, drowning stands out
Yeah.
as a particularly alarming concern.
Okay.
Research has shown that individuals with autism are 160 times
Wow.
more likely to die from drowning.
160 times.
Yeah,
Compared to their neurotypical peers.
that's incredibly disturbing.
It is.
It makes me think about the unique challenges that individuals with autism might face when it comes to water safety and stuff.
Exactly.
Right.
For instance, elopement,
Okay.
which is a term used to describe when an autistic individual wanders away from a safe environment,
Okay.
can be a big concern.
Yeah.
Sometimes this wandering can lead them to bodies of water,
Right.
putting them at risk.
That makes sense. And I imagine sensory sensitivities
Absolutely.
could play a role as well.
Yeah, some individuals with autism are drawn to water.
Right.
Because of its sensory aspects,
Okay.
the feeling of it, the sound of it.
Right.
It can be almost irresistible.
Yeah.
And sadly, this attraction,
Right.
coupled with perhaps a lack of awareness about water safety,
Mhm.
can lead to tragic accidents.
So it seems like addressing drowning risk requires a multi-pronged approach.
Yes.
We need to consider things like elopement prevention, tailored swimming lessons,
Yeah.
and creating safer environments in general.
Right.
It's not just about teaching individuals with autism how to be safe in the water, but about creating a world where they're less likely to encounter those dangers
Absolutely.
in the first place.
I completely agree.
Yeah.
Now, while accidental deaths are a significant contributor,
Okay.
it's important to note that they're not the only factor at play.
Right.
Individuals with autism are also more vulnerable to certain medical conditions that can sadly contribute to premature mortality.
The research you sent mentioned epilepsy and gastrointestinal issues.
Yes.
Could you elaborate on those a bit?
Certainly. Epilepsy,
Okay.
a neurological disorder characterized by seizures,
Right.
occurs more frequently
Okay.
in individuals with autism. This heightened risk of seizures brings additional concerns,
Right.
particularly if a seizure occurs near water or in another hazardous environment.
That's a scary thought.
It is.
And what about gastrointestinal problems? What kind of issues are we talking about here?
Individuals with autism often experience a range of gastrointestinal problems like chronic constipation,
Right.
diarrhea,
Okay.
or irritable bowel syndrome, IBS.
IBS, got it.
These conditions can be incredibly debilitating,
Okay.
and in some cases can even lead to life-threatening complications
Wow.
if not managed effectively.
It sounds like we need to move beyond the misconception
I agree.
that autism is solely a neurological condition.
Yeah.
It's clear that physical health plays a crucial role as well.
Absolutely.
And we can't forget about mental health either.
Of course not.
The sources you shared highlight a deeply concerning trend.
Hmm.
Suicide is a significant risk factor,
It is.
especially during adolescence and young adulthood,
Right.
for those on the autism spectrum.
Yes.
It's heartbreaking to think about those statistics.
Yeah.
What factors might contribute to this increased risk of suicide?
There's a complex interplay of factors at work.
Okay.
Social isolation,
Hmm.
bullying, and difficulty navigating social situations
Yeah.
can all contribute to feelings of despair and hopelessness.
Right.
Additionally, some individuals with autism experience anxiety and depression
Oh.
at much higher rates than the general population.
So recognizing and addressing mental health needs is absolutely crucial.
Yeah, it is.
We need to create supportive environments where individuals with autism feel safe, understood,
Yeah,
and connected,
right.
and ensure they have access to appropriate mental health resources.
Exactly. Early intervention and access to quality mental health care
Right.
can make a world of difference.
For sure.
But sadly, there are often significant barriers
Okay.
to receiving these vital services.
That leads perfectly into the next part of our deep dive.
Okay.
Let's unpack those barriers.
Right.
Explore the systemic factors at play. and discuss what steps can be taken to create a safer and more inclusive world
Yes,
for individuals with autism.
absolutely.
Let's do it. We've talked about some of these heartbreaking realities
Yeah.
surrounding mortality rates in the autistic community.
Right.
But now let's shift gears and explore
Okay.
what can be done
Yeah.
to address these challenges and create a better future.
I think one of the most crucial areas we need to focus on
Okay.
is access to healthcare.
Okay.
It's a fundamental right.
Right.
Yet, individuals with autism often face a myriad of obstacles
Yeah.
when trying to navigate the healthcare system.
What kind of obstacles are we talking about?
Well, for starters, communication difficulties can be a huge barrier.
Right.
Imagine trying to explain your symptoms or advocate for your needs
Right.
when you struggle with social communication or have sensory sensitivities that make medical environments overwhelming.
That sounds incredibly frustrating.
It is.
And it makes me think about the need for healthcare providers who are trained to understand and communicate effectively
Yes.
with autistic individuals.
You're absolutely right. Not all healthcare professionals are equipped to recognize and address the unique needs of autistic patients.
Right.
This lack of awareness and specialized training can lead to misdiagnoses, inappropriate treatments, and ultimately poor health outcomes.
So it's not just about access to any doctor.
Exactly.
It's about access to the right doctor.
Yes.
Someone who's knowledgeable patient and sensitive to the nuances of autism.
Precisely. And it's not just about doctors either.
Right.
We need a comprehensive network of support, including therapists, specialists, and social workers who are trained to work with autistic individuals.
And we can't forget about the families.
Of course not.
They're often the primary caregivers,
Yes.
navigating a complex and often fragmented system.
Right.
They need support and resources too.
Absolutely. Families play a vital role.
Okay.
And they need access to information training and respite care to effectively support their loved ones.
It sounds like a major overhaul is needed.
It does.
But beyond healthcare access, what other factors contribute to these higher mortality rates?
Well, we discussed how sensory and behavioral differences can increase the risk of accidents.
Okay.
It's not that these differences are inherently negative, but they can inadvertently lead to dangerous situations.
You mentioned elopement earlier.
I did.
Could you elaborate on how that might factor into accidental deaths?
Of course. Imagine a child with autism who's fascinated by the sound of running water.
Okay.
They might wander off seeking that sensory input and end up near a river or a busy street without even realizing the danger.
It's a parent's worst nightmare.
It is.
What could be done to prevent these kinds of tragedies?
Preventative measures are key.
Okay.
This could involve teaching children with autism about safety in specific environments, like around water or busy roads.
Okay.
It could also mean implementing environmental modifications, like secure fencing around pools or visual aids to help individuals with autism navigate their surroundings more safely.
It sounds like it's not just about teaching individuals with autism how to be safe.
Right.
It's about creating a safer world for them to exist in.
That's a great point.
Yeah.
We need to think about safety from multiple angles.
Yeah.
Individual skills, environmental adaptations, and community awareness.
Got it. And finally, we can't overlook the impact of co-occurring conditions.
Right.
You mentioned this earlier.
I did.
Can you explain what you mean by co-occurring conditions?
Sure.
And why they matter in this discussion?
Certainly. Many individuals with autism also experience other medical or mental health conditions alongside their autism.
Okay.
These could range from things like epilepsy, gastrointestinal disorders, or ADHD, to anxiety disorders, depression, or bipolar disorder.
So these additional challenges further increase the risks they face.
Exactly. For instance, someone with autism and epilepsy might be at a higher risk of having a seizure in a dangerous environment leading to an accident, or someone with autism and severe anxiety might struggle to communicate their needs in a medical emergency, resulting in delayed or inadequate treatment.
It's a heartbreaking reality.
It is.
It feels like we've uncovered this complex web of interconnected challenges.
Yeah, you have.
But where do we go from here? Is there any hope for improving these outcomes?
Absolutely. Awareness is the first step.
Okay.
By understanding the underlying factors, we can start developing targeted solutions.
So knowledge is power.
Yes, it is.
But what concrete actions can we take?
Well,
what can our listeners do to make a difference?
Well, for starters, we need to advocate for better access to comprehensive health care.
Okay.
That means ensuring healthcare professionals receive adequate training on autism and that there are more specialized services tailored to the unique needs of autistic individuals.
Right.
We need to push for systems-level change.
Okay.
And for increased funding for research and support services.
So it's about both quantity and the quality of care.
Exactly.
We need more providers who are equipped to serve the autistic community.
Yes.
And those providers need to be delivering high-quality, individualized care.
Absolutely.
What else can we do?
We can also advocate for policies and practices that promote inclusion and acceptance. This could mean supporting legislation that protects the rights of individuals with disabilities, advocating for autism-friendly spaces and services in our communities, and challenging stigma and misinformation whenever we encounter it.
So it's about creating a society where individuals with autism are not only safe, but also valued, respected, and fully included.
Exactly. And that's where individual actions come in.
Okay.
Even small gestures can make a difference.
Yeah.
Be patient with someone who might be struggling to communicate.
Right.
Offer support to a family who's caring for an autistic loved one. Educate yourself about autism and challenge harmful stereotypes when you hear them.
It's about shifting our mindset from seeing autism as a problem to be solved to recognizing it as a different way of being that deserves to be understood, appreciated, and supported.
Beautifully said.
Thanks.
And by embracing neurodiversity and fostering a culture of inclusion, we can create a world where everyone has the opportunity to thrive.
This has been pretty intense. We've covered a lot of ground.
We have.
From the stark statistics on mortality rates to the systemic barriers and societal misconceptions that individuals with autism face.
Yeah.
But I don't want our listeners to feel overwhelmed or discouraged.
I agree. It's crucial to remember that knowledge is power.
Yeah.
Understanding the challenges is the first step towards creating meaningful change. And while the issues we've discussed are complex and deeply rooted, there are absolutely things we can do to make a difference.
That's a really important point.
It is.
So let's shift our focus now to solutions and actions.
Okay.
What can our listener as an individual do to contribute to a safer and more inclusive world for autistic individuals?
One of the most powerful things anyone can do is advocate.
Okay.
Speak up for the needs of the autistic community in your local area, your workplace, and even in your social circles.
Got it.
Contact your elected officials and let them know that issues like healthcare access, education funding, and disability rights are important to you.
So it's about using our voices to amplify the voices of those who might not always be heard.
And it doesn't have to involve grand gestures or political campaigns. Simple acts of kindness and understanding can go a long way.
That's good.
Be patient with someone who might be struggling to communicate. Offer support to a family who's caring for an autistic loved one. Educate yourself about autism and challenge harmful stereotypes when you encounter them.
Those are all great suggestions.
Thank you.
It sounds like it's about shifting our mindset from seeing autism as a problem to be solved to recognizing it as a different way of being that deserves to be respected and supported.
You put it perfectly.
Awesome.
And that shift in perspective can lead to a more inclusive society where everyone, regardless of their neurodiversity, feels valued and empowered.
So as we wrap up this deep dive, what's the one message you hope our listener will take away from this conversation?
I hope they'll remember that while the challenges are real, so is the potential for positive change. We can create a world where autistic individuals not only survive, but thrive.
That's great.
And that starts with each of us taking action, however small, to make that vision a reality.
That's a beautiful and inspiring thought.
Thank you.
Thanks for sharing your expertise with us today.
Of course.
And for shedding light on such an important topic. To our listener, thank you for joining us on this deep dive.
Yes, thank you.
We hope you'll take this knowledge and use it to make a positive impact in your own way.
Absolutely.